I welcome Dr. Bhavani Shankar. Would like to know, a general expertise and background of yours. Can you tell me about your background and experience with stem cell treatment, and what specific types of stem cell therapies do you specialize in,
Yeah,
Doctor?
hi, and welcome to Neurosite. See, stem cell, when we say it's a very broad spectrum thing here, but as stem cell treatment therapy, we call so which we do from three different sources, which is from the bone marrow, from the adipose tissue, and from the umbilical cells. And with these three all main streams of stem cells, we are doing from 2011, and we are there from 2011, and we are still proceeding with this, and so many patients are getting benefit with this three type, and many in India, it is with the minimum manipulation of the cells, which is called as BMAC, bone marrow concentrate, and from adipose and umbilical cells we can help the patient to treat so many disorders like neurological conditions, metabolic conditions, uh, like CKDs also, and autoimmune conditions also, which can be benefited.
So, Doctor, can you tell us what is the success rates that you have observed?
See, it depends. It depends. Success rate will depend from the patient to patients and condition to condition. Now, just an example I'll give. Suppose you can take an example of stroke patient. Suppose a fresh stroke case which has happened 6 months or 1 year before. If this patient come to us, where we can with the stem cell therapy, it patient will show more improvement, more than 40% we can see. Now, similarly, suppose a patient which is 10 to 15 years before stroke case comes, where we can see 20% improvement. So the percentage of success of stem cells also depend in the duration of the disease when it happened, and it's how the patient take it to that.
So, Doctor, can you tell us what are the potential risks or side effects of stem
There
cell
is
treatment?
absolutely 0.0001%. There is no side effect of that, because we are not going to introduce any foreign chemicals or drug to the body. It's the same cells which is there in your body from in the bone marrow or in the fat. Same cells we take out, process in our lab, and give it to back with no contamination. It's a pure, healthy, and good cells.
Very nice. Doctor, can you tell us about the treatment protocols? Can you walk me through the typical stem cell treatment process
Yeah,
in your clinic?
yeah.
How do you determine whether a patient is good candidate for stem
Yeah.
cell therapy?
Yeah, the first thing first, day one, if you consider as like that, then first we ask the patient to send us a report, and if possible their videos to understand, because sometimes patient reports are old, 6 month old, 1 year old. So if patient send us the current video, we will understand how is the patient condition, like a stroke case or spinal cord injury case. So if the patient is in a wheelchair or having a tracheostomy or a rise tube, or it's how's the hand power, this thing, so we can understand. Then we can give the visa invitation letter so that they can come here for the treatment. Then the day third is, suppose we can consider in that way, then we'll do the blood test and consultation, assessment will be
So
done.
there is a pre-treatment evaluation,
Yes, of course. It
evaluation
is
or
important. It is
test that you require.
It is important to evaluate the case to give the maximum result to the patient. It's important to have a pre-evaluation, and the day when he will come, we will do one more evaluation to the
Evaluation.
patient.
Okay, great. So what are the conditions, doctor? What kind of conditions are most effectively treated with stem cell in your practice?
Like if you see the neurological disorders, then stroke, Alzheimer, dementia, Parkinson, spinal cord injury, all this is cases where we can see the good improvement. If you see the kidney problem, CKD, kidney, where the patient is not in dialysis, so there we can see more improvement. Then the metabolic conditions, you can see liver cirrhosis, you can see there you can see some good improvement. Spinal cord injury, you can see the good improvement, and in autoimmune conditions also you can see, like lupus, skin psoriasis,
Yeah.
rheumatoid arthritis, you can see good improvement.
So is there any risk?
No, there is no risk.
Okay.
Even if you do the bone marrow or adipose or umbilical, there is no risk. If we evaluate the patient in a proper way, we should know his clotting time, bleeding time, what is his power, lungs, ECG. That's what evaluation play a major role to avoid any side effect or reaction. Usually you can see the good improvement. And in autoimmune conditions also you can see, like lupus, skin psoriasis,
Yeah.
rheumatoid arthritis, you can see good improvement.
So is there any risk?
No, there is no risk.
Okay.
Even if you do the bone marrow or adipose or umbilical, there is no risk. If we evaluate the patient in a proper way, we should know his clotting time, bleeding time, what is his power, lungs, ECG. That's what evaluation play a major role to avoid any side effect or reaction to the patient.
Doctor, can you share any patient success stories? Do you have you remember on any example of significant improvements due to stem cell treatment?
Yes, we can. You can see in our website also.
Okay.
And there are few patients which have a good improvement. Like in opthal case, we see the patient of optical atrophy, where we, after the giving stem cell injection, patient vision improves. Then in diabetic neuropathy, in a stroke case, patient improvements are there. I will share you the video and the
Perfect.
details and contact details also to the patient.
Sounds good. So how do you measure the success of a stem
In
cell
that,
treatment?
same 20 to 40%.
20 to 40%. Okay, okay. What is the cost of stem cell therapy in your clinic, doctor? And
see-
what factors contribute to the price?
Yeah, it's contribute like suppose a patient of spinal cord injury and a diabetic patient. If you take these two example, means in spinal cord injury you need the rehabilitation, you need the physiotherapy, occupational therapy, and whereas the diabetic case you need no therapy in that way, only the stem cell IV injection. So there 10% cost will vary from patient to patient.
Okay.
So it fluctuates from $7,000 to $8,000.
Okay, okay. Are there any financial options or payment plans available
Yeah,
for the patient?
all modes is there. We are not restricted to one. You can pay by card, cash, online.
Okay.
Anything is fine. It doesn't have any problem.
You do collaborate with the medical tourism agencies like us for international
Yes,
patients, right?
like and the patient, it's better for the patient also, because when they come India, they want to explore India. They want to go to maybe all South India or North India, Kashmir or Ooty, Mysore. So they complete the treatment and they keep 4 or 5 days with them. They want to explore, and it is good for them. We help them to do that.
So is there anything for us, like for HealthMate, that you're promising to give us a special package?
Definitely
Which
I
can
do,
be-
and I know HealthMate from a long time, and I'll be happy to help and give the discount to the patient who come from this.
The best extended discount.
Definitely,
Sure.
100%.
Thank you so much for your time, Dr. Bhavani. Thanks a lot. Thanks for your time. We hope that your message and your time will be valuable for everyone and helpful for everyone. Thanks a lot, and
Thank you.
God
Thanks.
bless.
Thank you.